Alteration of foveal structure and thickness following blunt ocular trauma, a case series. So I have no conflict of interest to declare or no financial interest. So coming to the introduction part, ocular trauma is a preventable public health problem and it is one of the commonest cause of ophthalmic morbidity and monocular blindness. Excuse me. This is changing automatically. This is changing automatically. Please stop it. It's changing automatically. Yeah, next. Yeah, this is. So sorry for the interruption. So blunt ocular trauma forms the major part of the ocular trauma. It causes ocular damage by the cope and contracoup mechanism or by the ocular compression. Corvilli was first to introduce the concept of cope and contracoup injury by explaining the brain damage caused by the blunt trauma to the head. Later, Walter explained the eye injuries by blunt trauma using the same concept. Commercioretinal is a transient retinal opacification due to the...
You can exit slideshow and just present it as... exit slideshow and just present it.
Just change slide on manual mode.
स्लाइड्स को एंड कर सकते हो एनिमेशन में जाना एनिमेशन नहीं दिया ना नहीं एनिमेशन में आप ऐसे ही प्रेजेंट कर दो ऐसे ओके ओके फाइन
देखो उसमें डालता हूँ प्रेजेंटर पे डालता हूँ untick use timings
ये अच्छी कर लीजिए
अब डालो
So commercioretinal is a transient retinal opacification due to the outer retinal disruption occurring in a contracoup injury followed by blunt trauma. Histological studies. Can I present in this mode?
Yeah, sure. You don't have to present it in the slideshow mode. Don't worry. It's fine.
You uncheck this one if you can. Okay, please keep it like this. Thank you. Histological studies have revealed that disruption occurs at the level of photoreceptor outer segments and retinal pigment epithelium. In commercioretinal, optical coherence tomography examination reveals typical outer retinal changes corresponding to the photoreceptor damage. We know it is usually self-limiting and resolves within 3 to 4 weeks without any specific treatment. However, the photoreceptor damage may or may not be reversible, depending upon the extent of the initial trauma. Thus, the visual loss may be transient or permanent. So the purpose of this presentation is to describe the alteration of foveal structure and thickness following blunt trauma in 3 cases. Coming to the case 1, this is a 35-year-old male was referred to our hospital 3 days after sustaining injury with a cricket ball to his left eye. On presentation, he had a visual acuity of 6/6 and N6 in OD and 6/18 N10 in left eye. The anterior and posterior segment examinations revealed post-traumatic iritis, angle recession and commercioretinal in left eye with normal intraocular pressure in left eye, and the right eye findings were within normal limits. So this is the fundus photograph which was done at 1 day post-operative period, a 1 day post-trauma period, which is showing the commercioretinal. So the patient had already performed fundus photograph and OCT elsewhere before coming to our hospital. The OCT was performed at 1 day post-trauma, which has revealed increased reflectivity in the area of the photoreceptor outer segment, which we can see in figure. Now the visual acuity was maintained at 6/18 N10, and the repeat OCT revealed that complete loss of photoreceptor with the foveal thinning after 2 weeks, which we can see in the second OCT photograph. Coming to the case 2, a 19-year-old male was referred to our hospital 2 days after sustaining injury with a bamboo stick to his right eye. On presentation, he had a visual acuity of 6/18 pars and N12 in right eye and 6/6 N6 in left eye. The anterior and posterior segment examinations revealed traumatic mydriasis, post-traumatic iritis, and commotion in right eye with normal intraocular pressure. Left eye findings were within normal limits. So the patient had already performed OCT elsewhere before coming to our hospital. So the first OCT, which is taken at 2 days post-trauma, which is revealed increased reflectivity in the area of photoreceptive outer segments, which is shown in the first figure. Now the patient had undergone a second OCT after 4 weeks, which was done in our hospital, which had shown a complete loss of photoreceptor with foveal thinning after 4 weeks. And the patient had maintained a visual acuity of 6/18 and N12 after 4 weeks of follow-up. Coming to the third case, a 28-year-old male was reported 4 weeks after sustaining punch injury with a closed fist to his right eye. So when he had present to our hospital, his visual acuity was 6/60 and less than N36 in right eye and 6/6 N6 in left eye. The anterior and posterior segment examination revealed iridodialysis, angle recession, and foveal atrophy in right eye with normal intraocular pressure. Left eye findings were within normal limits. So both these OCTs, which are shown in this figure, were done at the outside. First OCT was performed 5 days post-trauma, which had revealed a disruption of the photoreceptor outer and inner segment at the fovea, which is shown in the first picture. And subsequent OCT was performed 4 weeks post-trauma, revealed a complete loss of photoreceptor with foveal thinning, which is the second photograph. So all these 3 patients maintained a visual acuity of 6/18 N10, 6/18 pars N12, and 6/60 less than N36 in first, second, and third cases respectively. Coming to the discussion part, commotion due to blunt ocular trauma necessitates a thorough ophthalmic examination to detect other serious accompanying injuries like globe rupture, iridodialysis, post-traumatic iritis, angle recession, traumatic optic neuropathy, and retinal tears, etc. We know that no specific treatment is generally required for commotion retini, which may resolve spontaneously within 3 to 4 weeks with recovery of vision. The treatment is essentially supportive and directed to the associated ocular injuries following blunt trauma. The visual acuity in commotion retini varies from 6/6 to 6/120 and may not always correlate with the degree of retinal opacification. The vision loss may be transient or permanent. The major site of retinal damage appears to be at the level of photoreceptor outer segments. OCT shows involvement of the photoreceptor outer segment with preservation of the inner retinal architectures, which also correlate with the histopathological study by Sipperle et al. So in conclusion, vision loss following blunt ocular trauma can occur due to various reasons which are yet to be elucidated completely. Alteration of foveal structure and thickness is associated with permanent vision loss following blunt ocular trauma. Clinical examination and evaluation using OCT may help in detecting the foveal sequelae and visual outcome in eyes with blunt trauma. These are my references. Thank you.
So could you tell me the findings of your second case again, the anterior segment and posterior segment findings of your second case of the case series?
Yes, sir. The second case, sir, anterior segment findings was traumatic iritis and there was traumatic mydriasis. And posterior segment was only commotion retini. There was no other complications.
Okay, so in all your cases there was a severe trauma which involved the iris.
Yeah, third case had the most severe trauma, but the third case came after 4 weeks. They had done all follow-ups in outside hospital and after that they came to us. And here, like first examination they had done in other hospital and after that they came to us.
So what is the aim of your this thing? What do you want to project out of your case series?
Because sir, most of the times we face many of the cases with commotion retini in trauma cases. But most of the times we see that visual recovery is excellent all the cases. Most of the times they recover completely. But these are 3 cases which we found that there was no visual recovery at all. because there is a loss of photoreceptors within 2 to 4 weeks of the trauma. So it may not be predictable always that how the patient will.
Could you correlate with any other cases which recovered? So what is the difference between those which have recovered and those which have not recovered?
Yes, sir. I had not compared in this study, but yes, we had seen many cases like there was clinically there was commercioretiny, or there may not be in commercioretiny, but in OCT we had seen that photoreceptor segments there is some disruptions, but later on the patient may regain vision up to 6/6 or 6/9. We might take a study in later on to compare these effects.
Okay, thank you.